There are certain genetic conditions, and what I mean by that is sometimes, as an electrophysiologist, sometimes we don't always see acquired heart disease. We see congenital things that people are born with. And there are genetic diseases out there that put one's heart at risk of having a dangerous, fast, abnormal heart rhythm. We call these channelopathies, which are, ion channels in the heart muscle that regulate the electricity. And if there's an abnormality in those, there are some diseases that can put you at risk of having dangerous fast rhythms. And if it's very short and you lose consciousness for it but the heart is able to get back into normal rhythm, they would wake up and being like, what happened? And so it is possible.
So when you say channelopathy, so there's a problem, so you're speaking about some of the minerals that are associated with electrical charge and transmitting that impulse?
So there are, if you think about it like, the cells of the heart, kind of like rooms in a house. There are doors where, sodium, potassium, calcium are going in and out of. These are channels like on the outer surface of the cell. And if you have a genetic abnormality where one of those cells isn't functioning the way it should, that can lead to either more current, like initiating an abnormal rhythm, or a normal heart rhythm impulse occurs, but it continues to go when it should have stopped. And so, so that's where so something is wrong with one of those channels that causes abnormal electricity to either perpetuate or initiate when it shouldn't.
Are there any symptoms or signs that you can look for that may tell you, hey, this person either is at risk or has had one of these events?
Yes. In general, if someone has, so we use the term syncope as, you collapse and there may or may not be an associated loss of consciousness. In general, whenever it occurs in the setting of high exertion or a stressful event, that usually is a red flag to most cardiologists and most physicians in general, because that could be the first symptom of an underlying dangerous cardiac rhythm problem. But it's not the same as, getting dizzy and lightheaded when you stand up quickly, getting out of the shower.
That's what I was going to ask you. I mean, is that, because you think of syncope, think about somebody fainting.
Right.
So that would be.
Yeah, the most common cause of syncope usually is going to be something related to underhydration, not eating enough, or what we call reflex syncope, where sometimes, a pain trigger causes your heart rate to go a little high, you get a little dizzy and lightheaded, you may or may not lose consciousness. We all know someone who sometimes is passed out when they go to the doctor, when you see a giant needle and you turn pale as a ghost. And usually when you wake up on your own, more often than not, that's usually not related to a cardiac rhythm problem. However, it's up to ideally they should hopefully have seen their primary care doctor, told them that. That's kind of when a lot of primary care doctors do have some tools in their arsenal to kind of start the initial steps. And the scary thing about a lot of these conditions is sometimes, you can go like 5, 10, 15 years, you have this genetic abnormality, and you may never know anything until your first sentinel event.